Rahim, Assalamu alaikum. Welcome back. It is exactly 8:39 a.m. News and views with me, Julia Ali, right here on Salam Media. And just when I thought it was safe to go out, lo and behold, we are hearing mumblings and mutterings about an Omicron subvariant, which apparently increases your risk. And also, I just want to say something. I've been going out publicly, shopping centers, malls, etc., etc. And I haven't stopped wearing my mask. I've even been to visit a family member in hospital over the past few days. Allah grant her and everyone who are, sick and in hospitals, total shifa, inshallah. And I noticed that when I went to the clinic, nobody was wearing masks, not even the medical personnel. And I kind of asked myself the question, am I being overly cautious? Should I just dump the mask? Or what's going on here? Uh, I've carried on regardless. So that's the two issues I want to unpack today on the show this morning with Dr. Shameem Jaumdally. He is on holiday at the moment in Mauritius, might I add. So that's where he's connecting up with us from. And as we know, he's with the Lung Institute at UCT in the Western Cape, but currently on holiday. And we do appreciate you taking time out from your holiday to talk with us on this very important issue. Assalamu alaikum. Welcome to the program.
Walaikum salam. Shukran again for having me on your show.
So, Dr. Shameem, here I was thinking that the issue around Omicron and COVID are things that we kind of delete from our dictionaries, that everybody seems to have dumped their masks. I have carried on wearing my mask. What on earth is going on? I'm hearing that there is a sub variant which could increase your risk. Can you unpack this for us? Are we at further risk? And how serious is this then subvariant? And we also then come to the issue around vaccinations. Does this then suggest that this is going to be the new speak over the next few months, that we need to go for further vaccination? So over to you.
Yes, so just to maybe keep it simple, over the last 2 weeks, we have been hearing reports around us of people getting infected again with COVID. And this again, from our perspective in the field, expert in the field, we knew that it was going to happen because as we've seen now over the past 2 years, we will have waves of infection that will hit us at specific times. And these waves will be characterized by two main features. The first feature is that it's going to be driven by a virus that is new, that is different to the last one that caused the previous wave, and it will also happen at specific intervals. So we've seen now that waves generally strike around 4 months after the end of the previous wave, which for us happened around the time of March, April this year. And again, what we see now is a rise in the number of cases that's starting very gradually. We know that places like school, for example, will be some of the main drivers of this current wave because there is school right now. And what we do know is that over the month of, I believe it was the month of June, there was a new subvariant of Omicron that was documented to have emerged in South Africa. And right then at the time, we knew that this was going to probably be the virus that starts the new cycle of increasing cases. We don't want to call these waves right now because waves, brings back memories of, like increasing cases, people getting really sick, hospital getting filled up again. This is an increase in cases. it will most likely be like the last one that we had, where people will get infected, people will get symptoms, but it's not going to lead to people getting hospitalized and people dying like we've seen it in 2020 and 2021. So, yes, we knew it was going to happen, but we also anticipate that it's not going to be as problematic as we've known before, or even as the last wave that we've known.
Alhamdulillah for that. So, uh, do we know what these subvariants are looking like in terms of signs and symptoms? And have they been named or itemized, whatever the medical terminology might be? It's either BA 0.4567, whatever it is. So,
Yes.
what is it at this point, those two subvariants?
So, to be honest with you, the last surveillance that we had that drove the wave in South Africa were the BA.4 and the BA.5. This we got in the month of April around Easter time. And prior to that, we had the BA.2 that drove the last wave in South Africa in our summer, in our last summer. Okay. And for the last month and a half, the reporting in terms of testing, the number of cases that we're getting, in terms of the sequencing, what were the different variant or subvariant that are in circulation, has decreased because we needed to redirect our effort back to our normal mandate in terms of research in the medical field, so your HIV, your TB, and a lot of the other neglected diseases that do afflict South African, right? So we believe that this current one will be what would be probably termed BA.6. And what we also know biologically is that a variant that evolves would most likely show an advantage in transmission where it will be more transmissible than the previous one. But
Ah.
Alhamdulillah, fortunately, at the same time, while it's gaining a certain fitness in being more transmissible than its previous cousin, that's what I'm going to call it, it also comes with a decreased capacity to cause disease in the body. And this is part of the natural evolution of a virus for it to continue surviving and holding, like some form of presence in a community. It needs to be more transmissible, but it also needs to have less of an impact in terms of affecting and killing people, because otherwise there won't be anybody around to continue
Absolutely.
the spread of the virus. So to answer your question again, it would probably be the BA.6. It will be more transmissible, but it will also be less severe than what we've known before. And in terms of the symptoms that have been reported to date, it's exactly like what people have known with COVID. Your flu-like symptoms, your runny nose, your headache, your fatigue. But again, just like the other Omicron variants and subvariants that we've known, it does not seem to be causing very severe respiratory complication like the pneumonia and all the other shortness of breath that we've had before with the variant like Delta and Beta.
Okay, I have noticed quite a number of people in my own family have come down with flu-like symptoms recently, terrible runny noses, and all the symptoms that you've just alluded to now. Could that possibly have been COVID? And when you go with these signs and symptoms to your local GP, should he be, as a rule, testing for COVID? Or because, as you say, it is very mild, it is not necessary that you just carry on as per usual and get treated for flu? Is that
So they
effective?
also
Will that be effective enough?
Yes, so there are certain community practices, right? And just to maybe explain what you just reported now, I think, and earlier before you started speaking to me, I heard you mention that, people are not wearing masks, people are meeting up. And let's not forget that we're coming out of winter right now. And the winter months are generally characterized with respiratory viruses that show their face. At the beginning of winter, we normally have a virus that's called a respiratory syncytial virus that also causes respiratory infection and flu-like symptoms. And then past that, we get the normal seasonal influenza that we call influenza A and influenza B that will come and infect people and cause those respiratory diseases as well. And what we also knew was going to happen, especially this winter, was that people who would get infected by these different respiratory viruses would generally manifest more severe symptoms and will take more time to clear it because our body has not been exposed to those types of viruses over the last two winters prior to that in 2020 and 2021. Because remember at the time, people were wearing masks. People had restrictions in terms of gathering and meeting up. So therefore, the probability of that being transmitted was severely decreased. And even for the influenza, the seasonal influenza, we normally know that they are imported. They are imported from the northern hemisphere that comes out of their winter to the southern hemisphere. And before, because borders were closed, travel restrictions were in place, it was not as prevalent in the last 2 years. And because of that, our body and our immune system, more specifically, has forgotten what these viruses look like. The memory, the immune memory that our body has, kind of decreased. And now with those exposure that we've had this year, it will prepare us to be better in fighting them when we do encounter them next year. So to answer your question, was this COVID, this infection that you're describing now in people who have flu-like symptoms, again, as I said, in terms of uh, surveillance program that we have, most likely not, because we also keep tab of, is COVID there, is COVID coming back. We know that it disappeared for a few months as we expected it after a wave. So those were most likely the seasonal flu because that was the end of the season. But right now, as I said, we do have confirmed cases that are being reported at a higher frequency for COVID. And if people do get or manifest any form of flu-like symptoms that get accompanied by headaches, lethargy, it would probably be good for them to test.
Okay, two quick questions, two or three quick questions before we wrap up. In your, do you firmly believe, as a medical practitioner yourself, that we should continue sanitizing and masking up, or is it not necessary?
I think what COVID has taught us is that if we do have any form of manifestation of an early sign, especially of respiratory infections or respiratory symptoms, it would be fair to actually wear mask and minimize our meeting with people. Because whether it's flu, whether it's COVID, whether it's any other respiratory infection that people can get, it is not nice. It is not nice to be sick.
Of
It is
course.
not nice to have to stay
Yes.
in bed, to be tired, So we don't want to pass that on to somebody else, especially somebody who we care about, who we love in our household, in our surrounding. So I think that's important. That's the first thing that I want to mention. And I think moving forward now, because we know that cases are going to increase, and also because we know that COVID is and can still be a problem for the most vulnerable people, like your older people and people with a certain number of chronic condition, it will be in the interest of these people that we do take our precaution and wear masks, not all the time, but mostly when we are in indoor places where there's no ventilation, where there is large gathering. That would be the best advice that we can give people right now, because the mask is most definitely the most effective barrier against infection that we know and that we have, and it's cheap.
Okay, a few months ago, 2 months ago or so, we heard about the third booster shot that people needed. I think people that had taken the Pfizer vaccine, there was a call by the Department of Health that people needed to go out to get the third booster shot, but it wasn't driven. hard enough. It kind of, we heard about it and it just fizzled out. And there didn't seem to be a huge uptake. Do you think that the Department of Health will have another such campaign? Is it worth for us to take that additional shot? Is it going to help us, and is it going to prevent us from getting seriously ill?
So what I've also noticed over the last few weeks is that the government, the national government and the provincial government in general have started to actually downsize, testing facilities, vaccine facilities, because it actually takes a lot of money to run these facilities. And that was in line with like cases decreasing and understanding that the problem was not going to be as big as we've known it before. And what I can tell you is that the vaccination will still be important for people who are at risk of severe complications. So your older people, people with like the severe comorbidities like your obesity, your hypertension, your diabetes. So I will advise these people, if they've not had a booster shot and if they've not had an infection over the last 6 months or 6 to 9 months, that it will be in their interest to get that booster shot. But what I can also tell you, and I'm not going to be like like a vaccine salesman and just push the vaccine agenda. What I can tell you from the science that has been reported is that uh, an infection, somebody who naturally get infected, is exactly the same as somebody receiving the vaccine, because that person is being exposed to the virus and it's allowing our immune system to actually develop a memory and develop some form of response to that virus. So for people who've not been infected over the last 6 to 9 months and people who've not had a booster shot, and who are at risk of developing severe disease, I would say that it will be in their interest to get the vaccine, most
Okay,
definitely.
Dr. Shamim, my last question, and very quick because I have my next guest standing by. It's actually a comment from a listener and viewer, Sakumzi Tombeni. Walaikum salam to you. He greets us both.
So,
He wants to know if you believe in African herbs. He says there's that green herb, he doesn't give us a name, which is boiled and people drink it when someone has flu. Um, do you know about it, or have you undertaken any such research with this particular herb or any other African herb? Your
uh,
comments.
I don't have a lot of experience with traditional remedy, but from my personal experience, what I can tell you is that when I was little, my grandma used to boil mint when we had colic, like
Ah,
like
okay.
septomy, and give that to us. And I do believe that it worked at the time. And I am mostly inclined in what we call modern medicine, but again, I do know that a lot of these modern medicine have their roots in traditional natural sources. So if
Absolutely.
this person is saying that, like whatever he's doing, boiling some form of herbs that he knows has certain properties to protect, then why not use it? But what I'm
Okay.
also going to say is that, as I said earlier, biggest tool and the best thing that we have right now in our hand, and that's easily available, that's cheap to protect us, is our mask. And I would advise people from this weekend onwards, if they're going out, cases are going up, please take your precaution, wear your mask. And if you do manifest any signs of early respiratory symptoms, please stay away from people.
Okay, thank you indeed, Dr. Shameem Jamdali. Enjoy the rest of your holiday in Mauritius with your loved ones. Salams to one and all. Till the next time, as always, assalamu alaikum to you.
Walaikum salam.
It is exactly 8:58 a.m. Standing by to talk to us is Ismail Rawat. He's from KZN. He's going to talk to us about the halal economy, but we will go to him in probably a half a minute. So please stand by.